Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. Now, before we get into today's episode and our amazing guest, a quick note from our sponsor called Growth Solutions. We are your growth partner for busy health and wellness professionals. Growth Solutions works to eliminate your biggest headaches, such as new patient generation, improving patient communication, and practice operations with systems, processes, frameworks, and AI. Growth Solutions is not a vendor. We are a partner in growth. So if you've ever said this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can help. If you want to learn more, just drop the word growth in below or feel free to reach out to me on LinkedIn. But let's get into the important part of this episode today, and that's highlighting our guest. I'm pleased to introduce Dr. Suzannah Bozzone, a board-certified family and lifestyle physician who has been recognized for bringing infectious enthusiasm, you'll see that shortly, into the realm of workspace wellness and lifestyle medicine. Dr. Suze is the founder, director of her private practice called True Health Journey, as well as her employee wellness and keynote speaking business at drsuzeb.com. Her mission is to inspire and empower healthy and purpose-driven individuals, workplaces, and communities. Dr. Suze is a nationally recognized speaker and helped create an award-winning lifestyle medicine-based employee wellness programs. She's worked with major companies like TNAA, Porsche, Ackerman Law, Kenco Group, Unify, among many others. Dr. Suze is also a certified yoga instructor and busy mom of 3. She's been featured on multiple podcasts, in a magazine called Forks Over Knives, and the documentary Disease Reversal. She's also bilingual in Spanish and English, and great in different dialects along the way. You may hear that as we go through this. She's also written a nutrition ebook called The 4 Stages Toward Nourished Plant-Powered Life, and co-written a children's book about healthy eating called Lucy Kate and the Yummy Rainbow. And we'll drop links in there for that. So Dr. Bozzone, welcome to the Prime Health Podcast.
It's such an honor to be here with you today.
Yeah, absolutely. I'm excited for this. As I said before we started, I'm going to do my best to keep my energy up to yours. I don't know how I'll do it, but I'll try.
Well, it's going to be fun, whatever happens.
I always begin with this. What got you into medicine?
Yeah. So, I went to Davidson College, which is the most amazing place, or one of them on the planet, I think. And I really like to get right answers, Thought, okay, so I'm either going to go math or science. And that was just the way my brain worked at that time. And since then, I have learned how to read, and I really do enjoy reading, but that wasn't the case at that time. And so it was really kind of like, I need a black or white thing. And I really didn't have any experience in medicine. Thankfully, I was always well, and I hardly ever went to the doctor or anything like that. During my course at Davidson, I was on a swimming scholarship, and I was not sleeping, and my self-care was horrible. It kind of all applies to what I do now to a large degree, which is lifestyle-based medicine. Because I was really running myself into the ground, and at Davidson, I actually did do that, and I fractured my skull. So after swim practice, I went and got my blood type for the bone marrow drive and passed out and fractured my temporal bone, had a frontal contusion. Really, that was my junior year, and my swimming season was pretty much gone for that year. I had lost hearing in my left ear. I was paralyzed in half of my face. It was a pretty abrupt introduction to the medical system from a personal patient standpoint, I have to say. One that I wouldn't recommend, but that looking back has been really pivotal in my life to what I do now, because I actually saw doctors for the first time in my life. And I was pre-med already, and I was doing all the science, biology and chemistry and all those things. But to be a patient is a very different thing, as we all know, if anybody has experienced that. And so I was also a singer. I am a singer, and I was swimming, but just had gotten really into performing. And I really wanted to be able to hear out of this ear. And I was told, it'll probably come back. It's probably just nerve inflammation. So your hearing might get better. But then at my 3-month follow-up, it turns out it actually got worse. So I am profoundly deaf in that ear. And I was concerned because I thought, how is this going to affect my kind of new passion for performing and singing on the stage and with groups if I can't hear out of my left ear? And what really struck me at that time was that I saw a doctor who was kind of belittling, and he was ear, nose, and throat. He was very kind of big deal, like this is an amazing surgeon, but he seemed kind of relatively disappointed there was nothing surgical. And he was like, it doesn't matter, you have the other ear, like no biggie. And I was expecting him to say it was going to get better. I was not very body aware, and I didn't really notice that it was worse. And when he told me that it wasn't ever going to get better, in fact, that was very shocking to me. But the biggest thing I really took home was that I shouldn't have been upset, that it obviously wasn't a big deal. And so then I felt kind of stupid for wanting to cry and think like this is, and then looking back at it, I thought, wait a second, this is a big deal to me. And he so belittled it and so had no connection to what I valued, didn't even know I sang, didn't know anything about me, but just to him, it was just another quick visit in his day, in and out the door. And that was it. And I just thought, this is the reason why I need to go into medicine, because patients should not be treated that way. We as physicians need to meet patients where they are and know what is valued by them. And how can he call himself a healer if he completely belittled what I was feeling and what truly I was there for? And so that was really the true motivation for me kind of continuing the course. As you know, doesn't end in college. You go to medical school and then you go to residency. It's not a lot of sleep, and it's certainly a lot of commitment. So you really have to have a why. And that was what brought me into medicine from a true, I am going to do this standpoint.
Yeah. That's a sad story, but amazing story, especially how it drew you into medicine. The main tenets are to do no harm. And he probably thinks he's not doing any harm because he's not physically working on you. But the truth is the mental harm that he caused that I'm sure you've gotten over since, it's sad. And I appreciate you taking that as your passion to move forward and say, I will be 1+ better than this doctor that was there. Now, you've got two unique approaches to healthcare and private practice and employee wellness and speaking business. But first, I want to talk about the True Health Journey, your private practice. So what's unique about your practice versus the typical GP or family practice?
Yeah, for sure. So I am board certified in family medicine, and I practiced family medicine throughout. But when I got certified in lifestyle medicine, and if you're not familiar with that, it is a board certification process from the American College of Lifestyle Medicine. This was the stuff that people were asking me, right? I was a yoga teacher. I was into wellness, but yet I recognized that I knew nothing about nutrition. I didn't know anything about how to truly, what does the evidence say about guiding patients in healthy living? And I didn't get that through medical school. I didn't get it through residency. You hear things, when you're just like at the gym, or you're working out and there's trainers saying things, but you don't know if they're true. And unfortunately, a lot of times they're not quite, so there's a lot of, things that go around that are fads that are really not evidence-based. And a lot of people saying things that might work for some people, but don't apply to everyone. When I learned about lifestyle medicine, I was so excited because I truly was like, this is the stuff I've been wanting to know forever, is how to use your lifestyle as your medicine. And that's kind of the tagline, if you will. It's the evidence-based use of your lifestyle on what does the data say to use lifestyle to prevent, treat, and even reverse chronic conditions. So how does one go about partnering with a patient to de-prescribe medicine, which is my dream and what I would want to know, and I've recognized that in the medical system, despite really well-intended and wonderful doctors out there, I felt the more I learned about this and that it was feasible, despite what I had been taught, to reverse diabetes in certain patients, that I wasn't doing it. And in fact, by not doing it, I was contributing to the sick care crisis that we face. And when we see that chronic disease is 90% of our healthcare dollars, those are this year, or this last year, $4.9 trillion. It was $4.5 trillion the year before, $4.1 trillion. It's like I update this slide every year for my presentations. And 90% of what we are spending that ungodly amount of money on is preventable. It's through lifestyle-related conditions. Heart disease, our number one killer. Cancer, our number 2 killer. Diabetes, chronic conditions, and so on. And so as I was continuing to practice in mainstream medicine, but now knew the science of lifestyle medicine and wasn't really in an environment. It's so hard in a 7 to 12-minute office visit when the only way you're ever going to get a bonus, which I never got, was by seeing 25 and plus patients a day. The more you do to them, the more complicated they are, as long as you code it properly, the more reimbursement someone gets, but not me. And you're not treating the patients how the patients deserve to be treated. And if I were a patient, thank God I haven't been a patient long since that first experience, but I would want to know what are my options. And I'd want to know that instead of just giving you a blood pressure medicine and saying, take this for the rest of your life, I would want somebody to tell me, what can I do to improve my blood pressure through my lifestyle? What can I do to improve my blood flow, reduce my inflammation, and do that in a way that empowers me rather than gives me dependence on a lifelong medication and a medical system that in the long run, despite best interest in wonderful doctors, unfortunately doesn't have the patient at the center of that medical home, despite so many efforts to do that. And so as a result, I broke off with my amazing health coach and partner, Coach Chrissy Smith, and she is from the South. So I live in the South. I'm in Chattanooga, Tennessee. I grew up here, but my dad was from the Bronx and my mom was a dancer. So I never really got the true Southern lifestyle living in the South. And if you're going to work with patients in the South, you need to know, like, where they're putting lard, how sweet tea is made. What do you do with fried chicken? Now, Chrissy is amazing because she really helps with giving them recipes that can help fight disease rather than feed it, and giving them the how-to, and also knowing where their taste buds are coming from. And she kind of says, well, you know, it's like Santa and sex. Once you know, you can't unknow. And then you just got to dive in there. Our goal is really meeting patients where they are based on what they're ready to do. Really focusing in on nutrition, but that's not all we do. A lot of times, you know, you got to talk about sleep before you even start in on nutrition, or you got to meet the patients. Sometimes it's overwhelmed with stress. And so looking at that gap between knowing what to do and doing it, and hopefully giving them the tools to do that. And she's amazing. So she works individually with patients, and she does courses in Chattanooga, partnering with the YMCA and partnering with one of our great local hospitals, and does these amazing food as medicine courses that are so great and really reach so many patients. Because, you know, the thing about doing lifestyle medicine that's difficult after having worked in underserved populations, as so many have, and I have a true passion. I've worked in Spanish-speaking clinics, and the people that worked in these clinics, the patient, they were my family. It was amazing. And so to do a style of practice that's cash pay and not through insurance, you know, then it's kind of giving this practice to only the people that can afford it, when in fact, everyone really deserves to know how to live a healthy life and how to make that accessible. So we try to do things in the community, and I have to say Chrissy does that a lot more regularly than I do through these courses.
Okay. So you're speaking about the evolution of healthcare. There's the evolution that patients need to come in. Like, unfortunately, there's more sick care than well care right now. And the evolution of most of the people coming in want better, but it's a hard process to get them to convince, of course, because there's a cash pay component, but you have to change the way you eat and the way you look at food. And it sounds like in the South, that's a bit of a challenge.
It is a challenge. And that kind of is what helped me to branch through a couple of things. But I thought, you know, in working with individual patients, which I do love to do and I continue to do, it really, to me, it felt like more of what the need was as well as where my skill set was. And I think that's when you're trying to decide what's the right thing that the world needs and the gifts that you can give that really are switching you on to do what's meaningful for you. And that's really what I try to cultivate in everything I do and in all my patients, is that, well, how can we make your life something that you're really tied into what matters most to you, and that's reinforced. And so with that in mind, I really felt like a better use of my skill set was to apply these lifestyle medicine techniques to communities and to workplaces, being the community that I love to work with, because you have, in that situation, you have a community that's built in, as opposed to me working one-on-one 90-minute visit with a patient who might, hopefully they don't do this anymore, but initially when you're so fired up about this and you're like, want to tell them everything, and then they walk away and their take home was, so I can't eat my wife's cooking, you know, then that's actually not helping. So, you know, if you do this, it'll decrease your inflammation and we can reverse that insulin resistance and we can do all that stuff. But you got to meet them where they are. And so what works a lot easier is to have a community and an environment that's nudging them towards healthier decisions, where it's celebrated and where they can find what they're ready to do and they can actually be encouraged to do it. And it's something that the community is trying to reinforce and nudge forward, so that there's not so much of that swimming upstream and adding to the stress and floundering and overwhelm that's already so pervasive, and why so many people are not doing the things that we know are important for healthy living. And so that's kind of what helps me to bridge into that and say, the goal is that it doesn't have to be such intentional choices that fight against the norm, but that if we could have healthier food access, if we could have crosswalks and sidewalks and lighting and a built-in work environment that encouraged walk and talk meetings, or that had yoga opportunities, or that had these kind of things as part of their culture, then you're going to be more successful, and it's going to be something people enjoy. It is not going to add another thing to the never accessible to-do list,
Yeah. And I think what's important is that from community, if you're working with the masses versus one-on-one, which it's important to do that, but when you're working with community, people want to be like other people. And if they see other people getting healthier, they want part of that. So when you work from an employee standpoint with a corporation or a local business, how do you kind of mold them into understanding the importance of your true health journey?
So generally speaking, and it's been kind of different in how I actually get into the businesses, but it's actually been largely word of mouth. I had an amazing patient who worked for an insurance company, and she had me do this talk because she worked with a bunch of employers, and she was really passionate and is really passionate about healthy employee workspaces, et cetera. And so then I did this talk, and she was like, "You're really good at that. Why don't you come in and we have these opportunities for you to do these webinars?" And I was like, okay, I didn't know that was a thing. And so then as it arose, that she was like, "Oh, this is great," because she needed to help these companies cultivate a wellness culture. That was kind of one of her roles. And then 15 with her job in this region, and then more and more and more. And so it just kind of gradually grew to where this particular, I just had wonderful partnerships. And this is within Cigna, that they're like, "Oh, maybe I heard that you talked about women's health, or I heard that you talked about resilience for this company and they really liked it. Will you come and I have a client who would like the same kind of presentation." And so then it just kind of organically grew from there. And that's been over, gradually, 5 years, but it takes a long time. It's kind of like they'll introduce you to someone and they'll say, "Oh, that sounds kind of interesting." And then 3 years later, they're like, "Oh, we'd like to schedule you." And you're like, "Oh, okay." So it's been, because I think that I didn't know that existed, and I can't ever inform. And I know that many of your listeners are likely practitioners themselves. And sometimes I have practitioners ask, like, "How do you get into these companies?" And I'm like, "I don't know." So all I can say is that I love doing it, and the honor that it is to then work alongside the HR team and say, "What have you done that's worked?" And you could kind of see their top, without any personalized data, but just like our top diagnoses are this, and this. While I'm talking about mental health, I happen to know that they have just an outstanding increase in their diabetes. And so then I might kind of put in there, well, if we talk about stress and sleep, and how that relates to insulin resistance and how hard it is to control your blood sugar if you're overstressed or underslept, which often go hand in hand. Let's talk about some tips. And then they can kind of start connecting the dots, where I'm not going in there talking about your disease stage, which is, obviously something that when I work with patients, our focus. And that's one thing that I think is a downer in the medical system, that we define and label and identify patients by their pathologic diagnosis codes. You walk in and you are then diabetic. And then how am I going to give you the tools and the passion and the power to live your life as the best person you can be when now your identity has been replaced with something pathologic? And I think that's a real obstacle to truly meeting patients and empowering them on their healing journey. And so the great thing about having an awareness and being able to practice lifestyle medicine is to meet them based on what they find important, and then give them the tools that then recognize a true reward gets them closer to their finest self. We have to identify what that is and recognize that a true reward, if I'm being honest and maybe have a little bit of a sense of humor, but I'm not being overly critical, which I think is how most people approach their health journey, then a true reward is probably not a donut. Like, treat myself. And, it's like, there's no worse punishment to me than a donut. It's like an immediate greasy face, bloated, guilty, like disaster. But that takes a little bit of distance and awareness and a little bit of a sense of humor to recognize that a donut no longer is a reward. And so, but if you take that on whatever level you want to take it to, whatever the habit is, whether it's wine or whatever it might be, then we can really start infusing power. But we have to do it from a place of, my identity is someone that is vital and searching for purpose, and I'm here for a reason, and my habits cultivate the person I am striving to become, or don't. And so if I look at that with mindfulness, then I can really start cultivating power in the journey.
Yeah. You bring up mindfulness, and that's very hard dealing with lizard brain activities that we're so used to over and over again. They know better, and you help them know better with the topics that you speak of. But then how do you increase their healthy behaviors to do better? What's your methodology to help them shift from, I know this now, I was told it, but what can I do to do this and act this out in my life?
And you're talking on the individual level?
Either way, I mean, whether you approach your patients directly or even, speaking to a group.
So with patients, and I do incorporate this largely or often, and it kind of depends. I do so many different presentations, kind of depends on what the topic is, but I'll often talk about the way I think we need to reform our medical interaction when I'm talking in groups as well as individuals, is to say, why are you here? And then to re-ask that question once they say, I want to lose weight, or once they say, I want to reverse my diabetes, or whatever the thing is that's disease-based. Usually it's the reason why they walk into a doctor's office is because of a number that's pathologic often, or a diagnosis that's pathologic that they want to address, but it's coming from the identity of someone broken. If you've read James Clear's book, Atomic Habits, it's such a great book, and it's so kind of like bite-sized and so applicable in so many ways. But he talks about, that if you're trying to quit smoking, say, and someone offers you a cigarette and you say, I'm trying to quit. Well, just those words are saying that you're a smoker. But if I offer you a cigarette and you say, I don't smoke, then I'm not going to offer you another cigarette after you've had a couple of drinks. I'm barking up the wrong tree because your identity has changed as you are now a non-smoker. And I think that we have to do that to some degree. Yes, you want a good, accurate diagnosis. If you embark on your journey as someone that is really there for a purpose, that really cultivates all of your successes and all of your failures to be the person that you're here on this planet to be. And that's the end point. That's the destination, to do basically to live towards your purpose and strive towards the person you're striving to become, which you can re-identify as that person at any age, and that's what's really empowering, that even if we've lived our whole life living our parents' life that they wanted for us, and we recognize that actually I didn't want to be a lawyer or whatever. But even then, there's great power and even additional vital years of life that can be added if we start living to our true self and living for purpose. And then that, yes, health is important, but why? It's got to be demoted. Why is it important? Because it's necessary for us to have the blood flow to do what we're on this planet to do, basically. And that health is driven by our lifestyle. That's clear. But then what we do today is not what I'm telling you to do, but it's what your readiness tells you that you can do, that you have the capacity to do. And remembering along the way, every step of the journey, a true reward gets me closer to my finest self. So getting distance from the process and understanding, I recognize that I've always loved that dinner, but I feel like crap after I eat that dinner. And I sleep badly. And then I'm mean to the people that mean the most to me. And then I'm not doing the job I want to do because my brain didn't function because I didn't sleep well. So that dinner or those drinks or whatever that thing is actually isn't a true reward. And then we can start kind of addressing behavior change through power and not through criticism. And I don't know if you know Judd Brewer, but I always speak about his work because he talks about it. And this is something that I think is what I'm trying to employ. It's almost something that comes up every time I give a talk now, because it's so in the forefront of my mind that, if we are in our amygdala fear state, then we literally can't access our cognitive thought. Our blood flow to our prefrontal cortex is diminished. But not only that, if we're in the fear state, we can't begin to bring our body into balance and cultivate healing. And so when are we most in our fear state? I mean, from my personal experiences, when I was in the doctor's office as a patient, right. That's like the fear state. It's terrifying. And then we're reinforcing that fear kind of every time we work with patients. And the patients do it to themselves as well when they're like, oh, this is my weak spot. I've just got like this thing for cupcakes. And they're trying to force it with cognitive thought to be like, cupcake is a really high calorie, poor nutrient food. But you can't access that because you're eating it often in a stress state. When a state where you're like, ooh, I'm going to emotionally eat this. And so we have to recognize, where can I feel safe and cultivate safeness, get out of the amygdala, and then allow my body to truly begin the healing process. And so when working with patients, I kind of go through that what's your finest self? This is where health belongs. And now we're going to talk about what you're ready. You tell me based on I give you these resources when I put your picture together. But I talk about that in the same vein in employers where, if we talk about something like, why can't you focus, or you're stressed out or depressed or anxious, which is where I do a lot of work, or hormonal imbalance, women in leadership and how very stressed out women in leadership are and how that's affecting their peri and postmenopausal journey is big. And so if we only talk about, yes, hormones can play a role in that, but if we're only talking about what you need is estrogen, but we don't talk about what your adrenals are thinking and how you're sleeping and are we drinking alcohol and what are the things that we're doing on a day-to-day basis to nourish the person you're striving to become and to put your adrenal glands and your amygdala into a safe zone, then we're not going to really empower you as much as we could.
When you're saying those things, Dr. Suze, it's amazing because the adrenals have such a strong play in it. Stress has such a strong play. What I think you do because of your purpose and your passion in this is not only are you being a physician to them, but you're being a mindset coach to these people as well, because there is a true shift of conscious thinking versus subconscious thinking. Do you feel that way?
Totally.
Okay.
100%. 100%. And I think that's, it's almost like not allowed in our medical system, or is it just that we just don't have the time to get there? Well, it is kind of fascinating though. The more I learn, the more almost simple, not to say easy, but almost simple it becomes. Mm-hmm. Are we connecting to purpose, to self, to nature? And in doing that, does our brain know, is it day or is it night? These kind of really basic things that you feel like should be relatively easy, but yet they're so distant in our 21st century life. It's just kind of looking at it differently and recognizing that your perception creates your reality and shift our perception. If your cup has been half empty your whole life, then that's where the power is if you're going to really make some change. And unfortunately, we're spending 0% of our time there in the sick care system. I don't know if anyone's doing it, maybe in the therapy world, and not in the primary care world.
No, because 7 minutes, you can't get deep into, you're coming in for this owie, this boo-boo, this pain, abdominal, brain, cramp, whatever it may be. And 7 minutes just to get from there. Now let's step back and, oh, wait, come in next week and I can have another 7 minutes with you. It's a hard path. And it's not against the physicians. It is against the big business of hospitals and healthcare. I'm glad that there are people that branch out and offer that like you do and helping individuals and helping companies with that. So have you noticed when you're speaking to them, I'm sure you have kind of Q&As after a little bit, but have you noticed that there's been a higher demand and conversation for people looking for lifestyle medicine over the last few years?
For sure. 100%. Yes. And that's where I think there's great opportunity. I think so often when I speak with insurance companies, sometimes with brokers, mostly with employers. And so often the question is, well, where can I find a physician like you? And that's what's really great. I work also with Lifestyle Telemedicine, which is a group of all lifestyle certified telemedicine doctors. And so we have covered all 50 states. Currently, as I've kind of stepped out of some of them, I'm doing more speaking and a little bit less patient care. We have just a few states that are awaiting coverage, but it's a great kind of handoff. I think that's what's needed. I really think that it's wanted and needed. And it's so often when you watch the lights turn on, and I love talking to patients in person, or I should say rooms of people in person, when you can see their interaction. So often I do these webinars and I'm just talking to myself because all the screens are off. And I'm just like, I thought that was a funny joke. But I really enjoy when you can actually see the people, at least in the front where, sometimes the lights are so bright, but it's so fun to think they're listening, when something resonates and they think, yes, that's me, because I talked so much about how we compartmentalize everybody. You go to the heart doctor and you go to the gut doctor and you go to the shrink, but we've got to approach medicine in a holistic way and figure out how to do that for the masses. And the way to do that, in my opinion, is really through the community. Because it's the way people live. If we can really build infrastructures and address the food swamps and the food deserts and the areas that are cultivating sicker people that are often dependent on your zip code, your zip code does often dictate your health. And the way we built an environment in a community and then take that into the places where people live, where people worship. If we, and I'm in the South, and You drive downtown Chattanooga, but I just said it. And there's a lot of churches. And I think there's a wonderful opportunity for churches to have healthy potlucks and to educate people on nourishing their body. It's a great place for community. We know that community is so important. We know that loneliness increases the risk of chronic disease, that it's as dangerous as smoking 15 cigarettes a day, according to the recent Surgeon General report, right? And so community is so pivotal. But if we were to look where those communities are and how they're celebrating, are we having hot dogs, or are we, or is there any fiber? Could we find any fiber at one of these celebrations? So, just like things like that to make it fun and uniting, and to know that, food shouldn't be isolating. And a lot of times I think people really get excited about food as medicine, and then they go back to their life and they're like, I can't go to my daughter's birthday party, or I can't celebrate, I have to kind of stop living my life if I'm going to maintain my diet. And it should be something that unifies us. And when you look at the longest lived populations in the world, what do they say? I was listening to some interview with somebody in Sardinia, which is one of the blue zones. And he was like, people are always asking us, because we live so long, what are we eating? And we said, we don't ask what you're eating. We ask who you were with. Where is our value system in that, that it should be a way of life to live healthy. Unfortunately, the mainstream has become one of toxicity. But it's only been in the last, 50 years. And so we can change it, but we have to do it as a community.
Well, I love it how you're sharing it. For your business especially, it sounds like you're trying to grow the employee consultation side of it. So where's your focus right now in that business?
Yeah, so I am writing all the time, and I love it. I'm always, so you can write me on Dr. Suze B, or certainly on any of my various, I've got a YouTube channel and an Instagram channel, and I will get those messages. And so if you want to bring a webinar in, and I can give you information about that and how that works. And so I do mostly virtual, but I'm doing more and more in person, which I love. Right before open enrollment, September is so busy and so exciting. And then things kind of die down in open enrollment because the HR departments have other things to do, obviously. And so just helping and supporting HR where they are. Sometimes I do different things. Sometimes I'll come in and do a bundle package. I'll do 3, or I'll do a series. There's a few companies where I kind of do a webinar every month. One company I do every 2 weeks, 5th year with them, I think. So some of them I kind of help create alongside their HR. It's really important to work alongside them because they know their people. They know what the interest is. I really encourage people to take surveys, and I'll give them options. What is it that they want to hear more about? And so we're not bombarding them with things we think they should hear, but rather we're really reaching them where they are as to what they want to hear about in the format. Sometimes we'll do more cooking demonstrations, and sometimes we'll do more education or workshop based. I've led, so our Nourish book is a 4-stage book towards nourishment. It has resources and it has videos and it has just meet you where you are. It talks about a lot of the barriers and obstacles that I see with patients. So eating out, how do I continue to eat healthy if I'm on the road a lot? So it has a lot of resources, but I'm starting to walk companies through that. So it's 4 webinars and we go through it. And then they have the book and the resource. So that can be a journey that they can continue to have it's kind of a workbook style. And we have a full Q&A. So that's largely Q&A based. Sometimes I'll do walk with the doc, and I don't give personal medical advice, but it'll be like, let's talk about a few topics. This is a chance to ask all of your lifestyle medicine related questions. And it might be around a theme. So for one company, we do kind of pillars. So we'll do 2 months of nutrition and 2 months of mental health and 2 months of physical movement. And then we'll throw in kind of a mini pillar that'll be creativity this year. So talking about how creativity really, it's so valuable and understated, and it sounds woo-woo, but if you are in a journey, and my husband being an artist I watch this all the time where he's just in this zone, and you don't have to stay so rigid to the outcome. But when you get that flexibility to enjoy and be in the journey, the piece that he's working on or he's painting kind of comes to him more than him forcing it to look a certain way. And if you think about how important that is for leaders to be okay with a different outcome than they perceived, but then to recognize that the real money's in the journey. How can we actually thrive because it wasn't the way we looked at? And that cultivation of resilience and joy in the journey and being mindful then tends to make healthier, happier, better leaders. The ability to roll creativity into a workplace might seem outside of the realm of medicine, but it's so valuable for having people find their best selves and finding joy in the journey. And then you see, well, actually, you know what? Their blood pressure goes down. Their vital signs improve, their metabolic health improves if people are really doing things that give them joy and purpose in their life.
Yeah. When they're stressed, they can't be creative. And that surely means not at work behind a computer desk. So what's the vision for your business in the next 3 to 5 years?
Yeah, so my vision is really to continue expanding keynote speaking and creating curriculum for companies that's impactful. And that's really where I want to grow. I love it. I sometimes pinch myself because it obviously is not what I was trained to do in medical school, but these wonderful things happen along the way. If you allow them to form the person that you're striving to become, they all serve a purpose. So maybe I'm not a professional opera singer, but it was helpful. It really helps you kind of be at ease with when the slides don't work or when things happen. It's a beautiful time to do it because I think that people are craving, especially in a very hybrid, sometimes purely virtual world, people are craving connection. People are craving truly understanding. We have so much data and so much kind of the fire hose of information that's coming in at us. I think people really want to connect to real people and real things and understand how they can find power in the journey and simplify. And I think that that's really what I hope to give and to continue growing, the ability to cultivate that culture in a workplace, a culture of vitality and one that's unifying and one that maybe is even a little fun.
Yeah. And you've been fun along the way. So with working with these companies and the employees, do you have any success stories of, when you worked with one of them that you've heard feedback from people, whether it's an individual that attended or the company?
So, with TNAA, I've been working with them in terms of helping and working alongside their team. Again, I think this is the 5th year. We've been awarded recognition by Cigna for the program and what we've brought into that. What's more meaningful to me personally is I love when I hear, my husband did what you said in that webinar and his diabetes is controlled for the first time. Right? Or when people ask you back and they say, yours was the most well-attended and the most well-responded to. So it's so fun when you kind of don't know because you're often talking to screens that are off. And at the end, there might be some thanks or sometimes it's complete crickets. Some people are really engaged and they have loads of questions. And sometimes it's like, thank you, good night, and you have no idea. But it's so fun when, I just I worked for the company in May. And I kind of was like, oh, I guess, there you go. Because you turn it off and you think you kind of have your own idea of how it went, but you don't necessarily know. And then, a few months went by and she said, we thought it was so impactful. We want you to come in person and come and do a whole workshop with our leaders in our company. So they'll all be there. So that's just kind of like that's so cool because you just have no idea. So those are kind of the really cool moments that you think it must be making an impact and difference and resonating with people. And that's, if I'm wasting people's time, I don't want to do it. But if they truly are getting impact and then I get to hear about it. And when you read the comments and then you also kind of hear people say, I did a talk years ago. And this guy was in this room. It was kind of a big kind of, what do you call it? A country club. And this lawyer was in this room and I didn't know, because I didn't even know who was in the room. I just was kind of brought in by I think a broker. And then years later, he said, I saw you speak. And I did that breath. I kind of started them with the physiologic sigh. And he says, I do it every day. I do it, before work. I do it before big meetings. I do it. And he's like, it has helped me so much. And now I'm starting to work with their law firm and work with all their lawyers. And so it's, but years went by and I didn't even know that guy was in the room, so I think that's the most fun is when you kind of hear the stories and that it's actually something that's impacting people's day-to-day lives, because that's what it should do. It's how we live. And if we can live with more joy and vitality and even just having fun in the journey, then we're going to work better, we're going to live better, and we're going to be healthier.
Yeah, you hit it on the head by saying impactful. If it's impactful for them, it's impactful and purpose-driven for yourself. Now, I'll make sure I share all the links of how people can get a hold of you and your books and everything that were in there. So as we kind of wrap this up, I'm asking this question of the guests that go up on here. It's the Prime Health Podcast. What's your personal definition of Prime Health? Because for most people, it's optimal health, physical, mental. What does Prime Health mean to you?
Yeah, well, I think it's purpose-driven. Are we living for a purpose? Are we finding meaning in our life? That doesn't always mean that life is happy, but that we are living for meaning and that our daily habits reinforce that person we're striving to become so that we can do that. And that's really what I would try to cultivate in every appointment that I have with patients, and really try to send home with people after a talk. Because I think if we disconnect from that, then we're really losing a great opportunity to be our best self.
Yeah, love it. Well, Dr. Seuss, thank you for sharing your story. Unfortunately, I wish you didn't have to get into medicine that way, but maybe it was a good thing for you to get into it because it's impactful for others. And I tell people, yes, we would love you to subscribe to our shows and listen to what we say, but there's somebody that listened to this, and I would ask you to share it to the others so they can hear more about how Dr. Susie does what she does to make it impactful for people. You can tell by her passion, she wants to help human beings. And when you help one person, it means you help others that are out there. I would ask that you share this really for, if you love it, share it for a professional, share it for a friend. But it's important that we spread this out there. So, of course, I'd love it if you'd subscribe to the podcast as well. That's important. Again, I'll drop in the links for Dr. Suze below to connect with us. So until next time, remember that true wellness is a journey that we're all on together. Now, whether you're taking charge of your own health or guiding others in theirs, every step forward matters. Thank you again for your time, Dr. Suze.
Thank you.